Gifton Mkaya, waziri wa afya jimbo letu la Taita Taveta County. Swala la negligence is so broad. Unless we bring specific specific cases, then I'll be able to deal with that one. So let me not delve into negligence, because sometimes we misuse the word negligence, and negligence is so broad. It could be something you're calling negligence. If you get into now the medical front, it may not be again negligence. So we really need to dissect a case by case. On medical commodities, there is drugs and non-pharmaceuticals. Right now, I can't say that we are so, I can say we are better than when we found the situation when our new governor took over the leadership of this county. When we came in, we had challenges because now the supply chain was so bad, but now we've put a lot of effort to improve the supply chain. Right now, we've gone back to KEMSA, and remember, we had run away from KEMSA in the previous government, but in the current government, we've gone back to KEMSA, and as you all know, there are a lot of advantages associated with getting these commodities from KEMSA. The issue was, of course, the long outstanding debt, which when we took, it was standing at around 89, and by November it had reduced to around 83. And right now, as we speak, we've reduced the debt to around 20 million, which we are going to clear. Immediately we get our current tranche, we are going to clear that all debt, and then now we move on. And as we speak, our account with KEMSA has been opened, and in December, before the closure of last year, we had received our first consignment, and probably next week we shall be receiving our second consignment worth around 33 million. So in terms of health products and technologies, we are doing well. And I think instead of just receiving blanket comments, sometimes you should just pay a visit to this hospital. You ask the medical superintendent to open the source for you, so that you can see for yourself what we have. And the other thing I can say, we cannot be 100%, that we have all drugs in this world. Sometimes some of the conditions are rare. You come with a rare condition and don't expect for the government to keep drugs for those rare conditions. So general, of course, what we call the essential medicines, those ones we are endeavoring to have them in all our facilities. So when it's a unique condition, definitely that patient will not get now that drug. So maybe that's, sometimes you can get some complaints. But now generally, as I've said, the essential medicines, as from next week, and as I said, we've changed our supply chain. This time round, our commodities will go to each and every facility, right from the warehouse from KEMSA all the way to the facility. We are doing what we used to call the last mile. So there will be nothing like, bringing commodities, we store them somewhere, then we start struggling to distribute, and we don't have distribution facilities. So those things will be a thing of the past.